And I'm using the sagittal ones just because, unlike the mud puppy and the shark skull, we're going to look inside too, the place where the brain resides. All right, let's take a look at some of the external features. And we can see them all pretty nicely on this. Now, when you're working with the cat skull, it makes your life easier if you can find a younger animal with good suture lines. Sutures begin to fuse together once an animal reaches maturity. It's one way an anthropologist, when they find a human skull, can estimate how old a person was when they died. At about the time you're 45, you no longer have any sutures in your skull at all. So on an older cat, the sutures don't show very nicely, and it's hard to see where one bone ends and the other begins. So it's best if you can find a younger animal for this. And think of suture lines as the borders between countries on a map. All right, that way you can identify what I'm tagging on the exam. So the first one, holding the incisors, we have our premaxilla, just like we saw in the mud puppy. And behind it, holding the rest of the upper teeth, and making up the body of the nose is the maxilla. Okay, so all of this is maxilla. Here's our nasal bone, which is a thin little blade of bone, which of course you've seen used in martial arts films, right? It really is that small. Okay, so when you have a large nose, it's not that you have big nasal bones necessarily, it's the maxilla that's really responsible for the bulk of the size of your nose. All right, looking on the inside here, we can see our premaxilla. There's our maxilla. There's the palatine bone that makes the hard palate with the maxilla. We have a hole here. This hole is the anterior palatine foramen. There's a right and left one. In humans, there's only one, and it's behind the incisors, so we call it the incisive foramen. And back here on some of the animals, you'll see the holes of the posterior palatine. It's staying on the side here. Got a hole right here below the eye socket, infraorbital foramen. Here's our eye socket, the orbit. All of this is frontal bone, including the postorbital process and coming into making up part of the orbit. Here's our malar bone, which has two processes. Again, a postorbital process, superior and inferior, and a process that helps to make the zygomatic arch called the zygomatic process. And of course, the zygomatic process is made up of the zygomatic arch is a twofold structure made up of the zygomatic process of the malar and the zygomatic process of the squamous. Okay? All right, now looking in here, oops, this one's not good for that. In the corner of the eye socket, we have a hole. That hole is the nasolacrimal canal, and I will take lacrimal canal. Another word for canal is going to be meatus. The groove going into that nasolacrimal canal is the lacrimal sulcus, or you can use groove if you prefer. The whole bone is the lacrimal bone. Lacrim is the Latin word for tears. You cry from the corner of your eye. Basically, you're making tear fluid all the time, and the excess fluid drains down here into your nasal cavity to keep your nose moist. That's why it's called the nasolacrimal canal, and that's also why when you cry, your nose runs, because all this excess fluid is going into your nasal cavity, breaking up the mucus. Now, behind the lacrimal bone is a short little extension of the ethmoid called the planum. We don't have a lot of these showing, so I wouldn't worry about this bone as much as some of the other ones. All right, let's see. Now on the side here, we did our frontal. Here on the side of the skull is the parietal. This bone here, its border looks like the scale of a snake, squamosal. The squamosal and this other bone here together make up what's called the temporal in humans. This bone is kind of like a Y shape, is the mastoid. And this bump that you can feel right here on yourself is the mastoid process. And the hole next to it is called the stylomastoid foramen, because in the human skull, right next to the mastoid process is a styloid process that kitty cat doesn't have, but we named everything on humans first. So the mastoid and the squamosal make up our temporal bone. That's one reason why cat skulls are harder to learn than human skulls, because we have more bones. All right, so squamosal, parietal. Here we see a little bone between the right and left parietal. That's interparietal. We have a crest here to anchor muscles for the cat to bite into its prey, sagittal crest. We have this crest off to the side called the lambdoidal crest. The reason why it's called lambdoidal is because when you put the two bones together here and you see the interface between the sagittal and lambda, you get the Greek symbol lambda. And that's where the name comes from. Now the lambdoidal crest, or ridge if you prefer, is made up of two occipital bones, supraoccipital here and exoccipital here. The exoccipital will also have the occipital condyles and foramen magnum. We also have an occipital at the bottom of the skull, which is the basioccipital, the base of the skull. Again, in humans, the basioccipital, supraoccipital, and two exoccipitals fuse to make what we call, back here, the occipital bone. All right, so looking at this, of course, here we can see a really prominent rounded feature, the tympanic bulla. That helps to resonate sounds. Between the tympanic bulla, we have our basioccipital and a pair of holes here. These holes are for the jugular vein, so these are the jugular foramen. In front of the tympanic bulla, really kind of hard to see because the tympanic bulla kind of hides it, is a hole right there. That's the carotid canal for the carotid artery to come in. All right. Again, here's our occipital condyle. If you look on the inside here, you'll see a hole right there. That hole is the hypoglossal canal for the hypoglossal nerve. We'll talk about how that ties in with speech and all that in humans later. All right, so now we get to the part that you had on your quiz today. It's a little hook-like projection. That's the pterygoid hamulus. And it's on a wing-shaped process called the pterygoid process. On a bone that has this wing to it and a second wing-like structure